Welcome to the PD Pet Care Vlogs. I'm Dr. Cath Watson. Today we're going to cover a fairly sombre topic, and that's euthanasia. This is an inevitable part of the end of life, unfortunately, much as we would all really like to just pass away in our sleep and have our pets do the same thing. Unfortunately, in the vast majority of cases, we need to be considering euthanasia. So I'm just going to run you through what to expect when the time comes. So first up, there's going to be some discussion with your veterinarian about where this is going to happen, why it's happening, and then making sure that you understand what the process is going to involve. And usually it's going to involve you signing some paperwork to confirm that you understand what euthanasia means, which is essentially a good death. And secondly, that you understand that this is permanent, not reversible, and usually there'll be some discussion in there about what's going to happen to the body afterwards. So are you going to take the body home with you to bury, and then what are your responsibilities around that? Are you wanting cremation? Are you looking at other options? So that first piece is all about understanding that you know what's going to happen, and that you're consenting to the process, and obviously that you are the legal owner of that animal as well. So when it comes to the actual process of euthanasia, depending on your veterinarian and the situation, in many cases sedation is going to be offered. And there are a number of key reasons why I would strongly recommend you consider sedation prior to euthanasia. Firstly, it reduces the stress level, and that's for everybody involved, because it is a stressful time, it's a very emotional time, and our pets are actually pretty good at picking up on those emotions. So if they know you're upset, they don't necessarily know why, but obviously that's going to put them in a higher state of arousal as well. So that increases their stress levels. So sedation just takes all of that away. The second big reason I would strongly consider sedation in almost all pets prior to euthanasia is that often we're talking about older pets, and usually there is some degree of pain or arthritis or mobility dysfunction. And when we're actually performing the act of euthanasia, we do usually put the drugs that we use intravenously, so into a vein in the leg. That means we have to hold the leg, and often somebody has to hold up the vein for us as well. So that can be quite painful if you've got arthritic elbows or uncomfortable in other ways, and particularly if it's difficult for them sitting. So sedation is a really good way of removing a lot of the stress, but also some of the potential pain associated with being asked to sit in uncomfortable positions or being held. So in some cases a catheter will be placed when it comes to that intravenous injection, and if sedation's been used, then my recommendation obviously is that the catheter placement happens after the sedation, because it reduces the pain and the stress associated with that procedure as well. In some cases it will be a straight needle that's used. It's usually up to the veterinarian what they feel most comfortable with. When it comes to the act of euthanasia itself, which, as I said before, is all about creating a good death experience, which is opposed to what we'd term killing. It's not always a good experience. So when we're looking for a good death experience, we use a barbiturate typically in veterinary practice. This is a very, very fast acting medication that's essentially an anaesthetic, but we're giving such a high dose that it's obviously a permanent anaesthetic. So it's effectively poisoning the brain and shuts the brain down very, very quickly. If you've never been through an experience of having an animal euthanized previously, one thing I like to warn most people about is that the effect of these drugs is almost instantaneous. So in many cases, by the time I have finished injecting that barbiturate, the patient has already passed away, so is no longer conscious, heart's not beating, no physical responses, so it can be a very, very quick effect. That's a really good thing from the animal's point of view, because obviously it's all over very quickly. We don't want to see any delayed suffering or side effects from the drugs. But from the person there saying goodbye, it can be quite tough when it is that quick. So prepare yourself for that, because I think in my experience, one of the most shocking things for people, one of the most common responses is it that quick? I think a lot of people expect it to be a very drawn out affair, and it's not. So what happens immediately after the injection is given is your veterinarian will then be looking for signs that death has occurred. So listening to the chest for a heartbeat, potentially tapping the eye, looking for a blink, or touching the surface of the eye, which obviously normally would evoke quite a strong response. And also looking at the eyes for the dilation of the pupils. So this is all confirming that death has taken place and that there's been an appropriate amount of medication given. So there are a few changes that happen to the body immediately after euthanasia, and some of these can be a little bit disturbing to witness, so it's worth being aware that they could happen. There's some really minor things, like sometimes you'll see little muscle twitches, sometimes there'll be some hair that stands on end. I've seen cats whose tails have puffed right up. None of these are them trying to come back from the dead or anything like that. It's just different ways that the body shuts down. There's two really key things that I think people need to be aware of. First is that usually on death the bowels will release, so bladder and bowels. So they will normally pee themselves, and if there's anything left in the colon then they'll often poo themselves as well. And it can happen immediately after death, or it can happen even a few minutes later. But if you have decided to have the euthanasia performed with your cat or your dog sitting on your lap, then you just need to be aware that you may get a little wet and stinky if you've got nothing between you and your pet immediately afterwards. The other really big one is around agonal gasps. So these are the big breaths that they appear to take after you've been told that they've passed away, that death has occurred. These gasps can be quite large, quite dramatic, or they can be quite subtle and small, and they don't occur in all animals. We cannot predict in advance which one's going to be affected and which isn't. So usually you should have been warned right at the start about some of the things you can expect to see at the end. They can be 1 or 2 breaths, or it can even last for several minutes after death has occurred. This is not them trying to fight the drugs. This is not them trying to come back to life. This is just different ways of the body shutting down. And it happens to all of us, unfortunately, after death. So it's just one of those things I think you need to be aware of, be prepared for, because although we try to make the euthanasia experience as nice as we can for everybody involved, obviously some of these things are beyond our control. So I hope that's helped you to understand a little bit of the process that happens with euthanasia, and to be comfortable doing the right thing when the time comes for your companion.